CPR stands for cardiopulmonary resuscitation. You would only perform CPR on someone who is unconscious and not breathing normally. Check to find out if the person is unconscious by seeking a response. Do this by gently squeezing the shoulders and shouting a simple command like, "Open your eyes," "Squeeze my hand." A person who does not respond is unconscious. Call 000 to get an ambulance on the way. If you are alone with the person, you'll need to help as soon as you've called 000. Check the immediate area to make sure there are no hazards like faulty electrical cables. Don't put yourself in danger while helping others. Leave the person on their back or in the position they collapsed in. To clear the airway, you'll need to tilt the head backward so the airway is open without kinks or bends. Do this by placing one hand on the person's forehead and use the other to support the jaw using the pistol grip on the chin. This action will generally move the tongue away from the airway. The person may have dentures. Leave well-fitting dentures in place. Remove them if they are loose. If the airway is obstructed by such things as vomit or water, you will need to turn the person onto their side and clear the airway using the finger sweeping technique. Once the mouth is clear, check for normal breathing by look, listen and feel. Look and feel for movement of the rise and fall of the upper abdomen, and listen and feel for the escape of air from the nose and mouth. If the person is not breathing normally, you will need to commence CPR. To perform rescue breathing, pinch the nostrils so air can't escape. Or you can seal the person's nostrils with your cheek. Take a breath, open your mouth and place it over the person's mouth. Then blow to inflate the person's lungs. Start with 2 rescue breaths only. You shouldn't have to breathe too hard, just a normal breath. Remove your mouth from the person after each breath. After 2 breaths, you will need to compress the chest. Place the heel of your hand on the centre of the lower half of the person's sternum. Keep your fingers off the ribs. To prevent slipping, you can lock the thumb of your upper hand around the wrist of the lower hand. Or if you prefer, you can interlock the fingers of both hands. Keep your compression arm straight, with the shoulder of that arm directly over the person's chest, and exert pressure through the heel of the lower hand. In an adult, the pressure you apply should be sufficient to depress the breastbone 1/3 the depth of the chest with each compression. Chest compressions must be accompanied by rescue breaths. Work on a ratio of 30 compressions, then 2 breaths. Continue until the ambulance arrives or a doctor or ambulance officer tells you to stop.